There are many people who don't even believe that chronic fatigue syndrome is actually a real thing. That's right, whether it's people or healthcare providers or you name it, there are plenty of people who think it's like all in your head or all made up. But let me tell you something. I mean, this is a condition with real diagnostic criteria. There are multiple medical associations that have established diagnostic criteria for this condition. Not only that, but there are guidelines for physicians to help treat patients with chronic fatigue syndrome. This is something that's really important for us to talk about. I'm going to tell you all about chronic fatigue syndrome, what the diagnostic criteria are. That's what we're going to focus on in this video. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. First of all, let's start with the name, okay? I've been using the name chronic fatigue syndrome. That's sort of the old name, but that's the name that we often all recognize. There have actually been new names that have been established over time. One is SEID, that's systemic exertional intolerance disease. The other is ME/CFS, that stands for myalgic encephalomyelitis, chronic fatigue syndrome. So you might hear it sort of interchangeable. But either way, there are some definite diagnostic criteria that's been established in 2015. For example, I'm using the 2015 Institute of Medicine diagnostic criteria. I'm going to tell you what those are, okay? So there's sort of a lot of stuff here. I want to sort of help you keep it organized, but the first thing you should know is that this diagnostic criteria, it requires you to have three things to start out with in order to be diagnosed with chronic fatigue syndrome, or SEID, or ME/CFS. So let's start with the diagnostic criteria, but just to keep it simple, I'm going to start with the three diagnostic criteria that you must have in order to be diagnosed with this condition, okay? Again, this is according to the 2015 guidelines by the Institute of Medicine. The first, of course, we know that the hallmark or mainstay of this condition is severe and profound fatigue, right? That is very clear. But the first criteria is not just severe and profound fatigue that's lasted for at least 6 months or more, but it keeps you from engaging in your normal activities. You're not able to work your job like you normally would, engage with family or friends, do social activities. You're not able to live your life as you normally would. So it's not just severe and profound fatigue. It's that type of fatigue that interferes with your daily life, okay? It's not relieved by rest, this fatigue that you have, and it's not the result of sort of excessive exertion, right? You just have it. And also, it's not lifelong, meaning you haven't had this forever. This is something that happened sort of at a defined point in time. This is the first diagnostic criteria, okay? The second is something called post-exertional malaise. This means that your symptoms get worse after physical or mental or emotional exertion that would not have caused the problem before the illness, okay? So whether it's grocery shopping or vacuuming your floor or getting into a fight with your spouse or whatever, can literally cause your symptoms to be much, much worse after this physical, mental, or emotional sort of situation that you encounter, okay? And then the third criteria that is required is unrefreshing sleep. It's funny how sleep often is involved with so many things, but it is with this too. Again, this fatigue doesn't go away with sleep, by the way, but with unrefreshing sleep, what we're talking about is you have a problem getting to sleep, you have a problem staying to sleep. When you wake up in the morning, you don't feel like you slept or that you're refreshed from having slept, okay? Those are the three main criteria that you must have, all three, to qualify for ME/CFS or SEID, the newer names for chronic fatigue syndrome. I'll repeat those. That is severe and profound fatigue over 6 months, your inability to engage in your pre-illness levels of activity, working, socializing. Also, post-exertional malaise. You do something and you're just wiped out. And then, of course, third is unrefreshing sleep. Now, there are two additional categories where you must have at least one of them as well to qualify for the diagnosis, okay? One is you must have either cognitive impairment or 2, orthostatic intolerance. Now, I know you're saying, what does cognitive impairment mean and what is orthostatic intolerance? And once again, you need to only have one of those in addition to the three I just mentioned. So let's go through them. Cognitive impairment means that you have problems with thinking, memory, executive functioning, maybe you feel brain fog, you feel foggy, decreased concentration, stuff like that. That is what we mean by cognitive impairment, okay? And many people actually report those symptoms. Now, orthostatic intolerance, you're probably saying, now what is that? Well, that means that you get worsening symptoms literally upon standing or sitting upright, okay? Literally, like you go from a lying position, you sit up or you stand up, etc., symptoms are worsened. And by the way, orthostatic intolerance is quite bothersome because if you can imagine going from a lying to a sitting or lying to a standing position, and you get some of the symptoms that are associated with that in this environment, things like, you feel faint or you feel lightheaded. Maybe you feel cognitive worsening or headaches or nausea or increased fatigue. You feel worse sitting up than you do lying down. That is what we mean by when we say orthostatic intolerance. Once again, you don't have to have orthostatic intolerance. You just have to have either the cognitive impairment that I mentioned or the orthostatic intolerance. But you have one of those, and then you have all three of the items I mentioned before: the fatigue and can't do your daily activities, the post-exertional malaise, and the unrefreshing sleep. I know this can be confusing because there's a lot to it, but that's why I'm talking about it, is because I think people blow off, chronic fatigue syndrome, myalgic encephalomyelitis, CFS, systemic exertional intolerance disease. Again, these are sort of interchangeable names, the latter two being the more recent, but there is real diagnostic criteria, okay? And you should know that. You don't have to know exactly what they are. I'm doing this video so that you can know that there are diagnostic criteria, so you can take it to a doctor, you can talk to somebody about how you're feeling. Remember that this is a condition that can happen in anyone, but women are affected more than men. The age group of 40 to 60 is probably the most common age group, although it can happen at any age. Look out for my other videos on other aspects of this condition, such as what causes it, what treatments are available, etc. But please at least have this as sort of a basic primer for what constitutes the diagnostic criteria. Again, if you want to look it up yourself, take a look at the 2015 Institute of Medicine Diagnostic Criteria. You can read this yourself and sort of see the flow chart, which might make it easier. Let me know in the comments if you've been diagnosed with SEID or ME/CFS, the newer names for chronic fatigue syndrome. Let me know if you have, what you're doing for it. You might just help someone else. For those of you, by the way, on Facebook and YouTube, thank you for watching. If you've not liked and followed my page on Facebook, I invite you to do so. For those of you on YouTube, please subscribe to my channel and click the little bell. And both on YouTube and Facebook, I have subscription groups, Dr. Jen Superstars, and subscription groups on YouTube. I invite you to check those out and join me for exclusive content. Guys, I'm Dr. Jen. I hope this was helpful. I'll see you soon.